Oh, so, have you called it the meeting order?
Okay. So we are gonna call the public health, the Bay County Public Health meeting to order at 5:03. I'm not the chair, so I am not leaving this meeting.
We have active in attendance right now. Isaac, are you on yet? Okay, so I know hard, but,
So Isaac is still currently in the hospital. He is going to try to get on if he's due to be released tonight. So right now he's in the middle of, all of those things that has to be done with release. But he indicated that he was going to try to get on at some point if he's got a few minutes, to be able to participate.
okay. All right, so time's off 5:04. We have a quorum present. The first matter is the interim public health director. I'll give it back to the board to open up discussions on that. To put it in context for anybody curious, we had our current director, Johnny Wilkie, put in her resignation. So we need to figure out who's going to fill that role while we search for one.
So I went through my public health training, and in that process, I had been talking to two public health individuals from the state Department of Public Health. They indicated that at this moment, there are two other counties that are also looking for executive directors, and a guy by the name of Matthew Jackson, who is helping those other two counties, indicated he was willing to help our county. Additionally, a gal by the name of Pamela, who is part of the training board up there, is sending me and I will pass it along to the board, a manual that they have created in order to help facilitate the finding of a public health director. So,
and also, sorry, go ahead.
Oh, go ahead.
And also I received one application for the public health director today.
So for the interim, I believe the board's options are to talk to a contiguous county that's next to us to see if their director would cover. We could go through a third party as well, as Kathy Temple just indicated. I have concerns over the way the statute reads when it comes to CDPHE taking over as an interim director, so I would recommend going through either contiguous county, or if there is a professional interim director, that could be an option as well. I guess one thing before we get too deep in conversations, there's been a lot of confusion over scheduling meetings. This one as well.
Excuse me, Nathan. I would like to finish what I was saying. To clarify, any contact that we have already had initiated with public health out of the state is not for them to come in as an interim director. It is only for them to help support us in this process of finding an interim public director. Nobody from the state is going to come down here and become an interim or public health director. So I wanted to make sure that that was very clear, since we have a lot of people that have a lot of questions about this. So the board, I've been working on it. I know Isaac's been working on it. I am assuming that Jennifer's been working on it. This is a high priority, at least for me. But I wanted to make sure that because there's a lot of question and there's been a lot of innuendo and supposition out there, that this is not the state coming down here to take over anything with public health. This is their offering assistance to us the way they have offered assistance to every other county and every other county public board in the state.
Are you finished, Kathy?
I am, thank you.
All right, thanks. So as I was saying, we've had a lot of turmoil. We have a brand new board of directors. I have had some concerns over how the meetings were being scheduled. The commissioners today at their meeting voted to add Phil Hemphill and Commissioner Alan Stump to the board as on a temporary basis to get everybody on their feet. Had many years of dealing with CDPHE, and I've never found them to be helpful. If they're on, I would love to hear a response from them. But we've never received any actual help from CDPHE. They tend to be a hindrance to local public health unless you're in the right zip code.
Sir Nathan, today I received applications, one from the one to apply a director, public health director. So we only need the board members. We need to set a schedule to interview this person for the executive director.
Well, for a position like public health director, we have to put out an RFP so everyone knows the position is open to be given a chance to apply. So we can appoint an interim director while we go through that process. So we can certainly consider that application, and we consider them for interim too, but I think we still need to put it out for request for proposals.
I guess my understanding is that in previous times when we've had this situation arise, we approach Rick Ritter in Ontario. Has there been any contact with him?
Mr. Ritter's out this week. He'll be back on Monday.
So he's kind of familiar with our setup and
Yes,
everything, so.
And Mr. Ritter has helped Benton County Public Health in the past when there was a unusual issue or a large project.
So I have a question for what you just said about the commissioners being temporarily put onto the board. Does this mean that Isaac and I are no longer needed because now you guys have 3 commissioners on the board that would always constitute a quorum?
It hasn't been set yet. The commissioners had concerns over the way the meetings were being ran.
My understanding from my training is that Benton County's commissioners cannot take over Benton County Public Health Board because the statute written says that prior to 2008, they are grandfathered in. But if the Public Health Board was independent post 2008, they cannot come in and take over the Public Health Board. Am I correct in what they told me at Public Health in the state?
With the exception, unless the board is failing to act in an appropriate manner. And having a conversation with another board member outside of a public meeting is inappropriate.
Do you have any evidence that any board member has had contact with other board members outside of public meetings that deal with board business?
No, I have concerns. Trying to alleviate those concerns before they become problems.
Who is the one talking?
This is still Nathan. My concerns are that just in scheduling this meeting, there seemed to be a lot of confusion. We had an agenda approved for Wednesday. It wasn't published for some reason.
That was Joni. She didn't get it out. I was there Monday. Joni was there, so there was no meeting to be published.
I'm gonna make a correction there, Kathy, because it was sent out to the board member and then it was sent to her employees and they were told to post it as normal. Plus, that meeting was scheduled at our previous meeting, so it wasn't a fast thing. It has been on the books for a while now.
Oh, no, I would agree, but it does not have to immediately be published only 3 days ahead of time. It could have been published last week sometime as well. So when I was there on Monday, though, I hadn't received any agenda. I hadn't received any notification of meeting. And I didn't get anything until Wednesday.
And Kathy, that's exactly what we're trying to figure out what went wrong there. Because we did schedule this meeting at our last meeting and didn't, I think everyone got calls on Wednesday that the meeting had been pushed to Thursday.
I would agree. I mean, I was planning on being there on Wednesday, and since it hadn't been published, I there was not a whole lot that, I could do other than wait to see when it got published.
So, I mean, there was no doubt there's confusion over this meeting. My understanding is there was rumors going around that it would be Zoom only, not in person. I have no idea where this information is coming from, but I'm here to make sure it stops and we'll get the right track. That's the whole goal of this. I would recommend to the board that we do an open meetings training, we can do a formal public health training.
Okay, straight from the health department that was Zoom only. So I just showed up because it's only 7 miles for me, right? I can always stop by Dollar General, do an errand, get some gas, whatever, right?
So who had the ability to post on the public health Facebook section?
Yeah, there's no name, but somebody did.
But we can get the confusion stopped with a little bit of training. If people aren't familiar with the open meetings laws, it takes a second to understand our requirements. We just need to get this board on the right foot. So I think that brings back to the discussion, the interim public health director needs to be looking at the board to and discuss what you want to do in the interim while you put out the RFP for public health director.
I do appreciate the people that Kathy has reached out to and looked at different options for the interim position. And then I also appreciate Alan making the comment about how Rick Ritter is the public health director that sits directly next to us in the neighboring county, and that he has come in and filled in and helped us out before. So he would be very familiar with our employees and our processes, and I think it would be a really smooth transition to request of him to see if he would be interested in helping us out through this.
Question.
Sorry,
Are
I'm
we
on a
dealing
meeting.
with Public health and home health, I mean, you were the director, or both?
Essentially both.
Okay, and so then who was your assistant?
So I had an interim home health director that did what she could, and that was Megan Starstitch.
Okay,
But she was also out in the field, very busy seeing patients. So I still did a large portion of that.
so is she stepping up?
No,
Okay, so she's not stepping up. So are we dealing with a public health director? Are we dealing for two directors? Two directors. And so Ritter is only familiar with public health, true? So who would be the one for home health? Because home health to me is very important in my community.
We do have home health director on the
Okay.
agenda. Okay. Yeah, I
Sorry.
appreciate it. No, that's understandable.
Mhm.
Yeah, and I guess to finish answer to and I don't want to speak for the county commissioners, but
I love you,
there's
buddy.
been a lot of resignations between our last meeting and today, and it's extremely concerning. It's hard to find employees in this valley. But
I'd agree with Jennifer. Ritter would be a logical choice in my mind.
If you'll accept the position.
Yes.
Yes.
So
Jade, why
Okay.
did Papa have to leave you here?
I've got to clarify, why have there been a lot of resignations?
Trying to figure that out.
So we don't know why. They're just, so nurses or home health people, physical therapists who's quit.
Three nurses.
Big three benches.
Three nurses quit.
No one talking.
You gotta keep that down, buddy, so I can hear. Was Iris closing her eyes when you came in here? Will you go get my speaker? Will you go get Iris out of that drawer? My speaker thing? I think it's in that drawer. Will you get it for me? No. Oh, okay. Okay.
Whoever's pull over, I wanna mute Jen. I
Get back.
think it went on.
All right, so I just kind of get us on track. I heard the interest to reach out to Mr. Ritter. Anybody else who'd like us to reach out to? And I guess I should clarify, I don't think this can be considered an action item because we haven't discussed the appointing anyone with the people. Sorry, but if the board wants to give me direction, I can reach out to everybody you want me to.
I think you should reach out to Rick Ritter, and then if Kathy has information for the Matthew Jackson, it wouldn't be bad for us to reach out and have conversations with multiple people.
So who picks up the caseload of the three nurses?
Excellent question. That's why we want to figure out what's causing the resignations and stop them.
I'm sorry to be such a questioner here, but I can't see who's talking. And I would like to be able to know who it is that's asking questions and answering, just so that I can kind of keep track of what's going on. So I got as far as Rick Ritter being reproached for interim.
Yeah,
And then somebody asked another question about nurses. And at that point, it's getting really confusing because I don't know who's talking with whom.
So Kathy, the question was just on my comments of who was resigning but are you able to send me the contact info for Matthew Jackson?
I can. I don't have it exactly on me at the moment. I'm actually in Hayes, Kansas. So that's why I'm calling in. So all that type of information is still back home, but I can get it to you.
Okay. Good. Is there anybody else the board would like for me to reach out to? Okay.
I have. You're probably ready to get rid of me. I'm Pam Valdez. Anyway, when I watched the meeting the last time, I thought it was a meeting that was just gonna help kind of get the board and everything together, and then received Joni's resignation right off the bat. I was really hoping that there would be some resolution there. Is there any possibility, Joni, that you would continue or rethink if you could get along with the board better or find out what the problem was? Because it was not discussed at the last meeting, and I sure would like to know what the problem was that started on as a citizen.
So Pam, I would love to be able to openly answer that. I've given 10 years here. I've been your nurse.
I know, my dad is.
Yeah. And I'm not gonna throw anybody under the bus. I'm trying to be professional. So
But would you consider if the board approaches you to help get this
I
because
will,
of the information, or at least have you become part of one of the directors, is what I'm trying to say.
I won't say no to that, but I have not been approached. But I'm not saying yes either.
Okay, I just wanted to know, whatever. You got two bodies to fill, two positions to fill. And you got one that has information or has,
More positions than two, because
now you have three nurses.
we're missing nurses. Yes, there's more. There is like 5 or 6 positions to be filled, to tell you the truth.
And we've had 3 nurses that have been on our list of people we're trying to hire for quite some time. So I believe that they were down to begin.
Yeah, we've been advertising for nurses and home health director for well over a year.
So I have a
I was
question.
told by an employee that she has, if she already has not put it in, she intends to put in for home health director. So there is somebody that is currently on staff that is looking to try to fill that role. And so I did want to let that out, that it's not that there's nobody even interested even within the department to do that. There is one person that has told, me that that's what she intends to do if she's not already done it. And Llewellyn would have a better idea if that's actually happened.
So this is Ann Boswell speaking, Kathy. I'm just curious, if we know, I asked why, we have people quitting, but why it's been difficult to hire nurses when we know that there are a lot of people going into nursing right now. What are challenges to that? Because I'm always kind of curious, like, I know that in our field, we never have vacancies, what I do. But there are fields where there are a lot of vacancies, but there are also a lot of people who want those jobs. So why is it hard for us to get people interested in Benton County? Like, I think that would be a big piece to know, because that might even help us get a director, right?
Oh, no, and I would agree. So I've been investigating some of that on my own time. And some of the things that I'm learning, and I was going to bring out to the board today, was it's not just about pay. I have found out that throughout the last several years, there's been dozens of people who've applied to Benton County Public Health in a variety of roles between RNs, LPNs, CNAs, et cetera, et cetera, et cetera. And they've never made it even to the interview stage due to more gut feelings and thinking that this is what needs to happen, or various things. I've been told by several people that they have gotten as far as Joni's desk, and Joni's decided that they weren't appropriate and they never were passed on. So I don't know what Joni's rationale was for it, but I do know from multiple people, even on the eastern side from Prowers County, that have put in applications in Benton County and have either never gotten a call back or nothing's ever been forwarded on their applications. So I think that could be part of what seems like is a glitch. It could be, I looked at what we're paying our nurses right now for what home health is doing for the state. And we are on the lower end of it, but considering where we live and our cost of living, it's not completely out of touch. I personally would like to see, whether they're a nurse or an LPN or a CNA or anybody else, making, good money, being able to do well. I just want to make sure that we're not putting the money across the board unnecessarily. I'd like it to initially go toward the people that are providing direct care, and then moving it to more administrative roles if that's what we need to do. But I was told by this Matthew that there was a guy out in El Paso County that they were willing to pay almost $250,000 for a home, for a director. And people were not wanting to be a director for that. So I don't know that some of this has to do just with money. I think it has to do some of it with, the rules and regulations that they have to follow, and the trainings that are offered, and further education, and we can sweeten the pot doing a lot of things that don't just necessarily go back to the traditional ways of trying to recruit people. But when I was in Prowers just this last month, I talked to 6 registered nurses who 2 of them came from the prison. 4 of them were in and about doing adjunct stuff at the college as nursing adjuncts. And they all indicated that as PRNs or doing different things on their schedules, they are interested in applying, but right now they don't know who to apply to. So that is part of the glitch that's keeping them from doing it. So I think that there is interest out there. I just think that we just need to have a pretty consistent and straightforward way of that application process so that people know, if I apply here, then this is what's going to happen down the line. And there isn't a lot of ups and downs and maybes.
Okay, so we can certainly look at the application process, how open jobs are getting out to the public, and their instructions on how to apply. I will say too, I'm sure everybody's aware, we have trouble maintaining higher educated professionals in the valley. And public health really got hit hard during COVID. There was mass resignations. Public health seemed to be the lightning rod for the state's policies, where public health wasn't making the policies, the directors were taking those hits. The directors of public health nurses were getting death threats, being treated very poorly. So from what I've seen is, if you are a registered nurse and you work public health and be subject to that kind of abuse, or you work at a hospital, it's not a hard decision. And it's a systemic problem we have, not just in Benton County, but clarifying the process on how we get the word out on how to advertise jobs and let people apply within this. Okay. So Rick Rader and Matthew Jackson, is there anybody else the board would like me to reach out to?